Hello everyone, this is Group 15. Today we will embark on a journey to uncover the rare human outbreaks of simian malaria in Malaysia. Malaria is a life-threatening mosquito-borne blood disease. It is caused by a parasite that is spread to humans by mosquitoes. The most common parasite found to cause malaria is called Plasmodium falciparum. However, the parasites responsible for the simian malaria in Malaysia are called Plasmodium cynomolgi and Plasmodium knowlesi. Symptoms of the monkey malaria in humans include headache, nausea, flu signs, and fever, all of which are very similar to normal malaria. This is a One Health problem because health officials say the destruction of the environment has caused the monkeys to get closer to communities, therefore allowing transmission to humans to occur fast and efficiently. We need One Health because we need to consider the animals, humans, and environment to reach a holistic solution before simian malaria becomes an uncontrolled health burden.
When considering how simian malaria can be tackled from a top-down approach, there are several actions which must be taken. The government will mediate a team of several different influential groups of stakeholders. There's a need for environmentalists, doctors, veterinarians, public health officials, and government officials to work together in creating effective preventative measures for the public. Within the realm of healthcare, there should be a creation of proper educational programs to help providers better recognize the P. knowlesi strain of malaria. When considering the wildlife that's susceptible to the pathogen, government should take measures to ensure a decrease in the Anopheles mosquito population within forest habitats of the simian environments. Safer prevention methods that spare the use of toxic chemicals include netting, clearing out puddles of water, and auto-dissemination, which focuses on stopping larval reproduction. The government will be a driving force that gets people on all levels involved. Government aid issued toward funding research of this strain of malaria will allow the creation of effective treatments. Government aid can also fund the treatment of patients who cannot afford to receive care. Educational programs for the public should encourage sanitary and preventative practices, as well as allow individuals to catch symptoms of simian malaria in themselves or others. This all ties in to ensure that the further spread of pathogen is prevented and that there will be a trickle-down effect.
A bottom-up approach in order to solve the One Health issue of simian malaria in Malaysia will include three parts. First, in order to avoid the language barrier, we can gather the public representatives and translators, telling them that some of their lifestyle may lead themselves to a high risk of getting infected by simian malaria. So we will encourage the local community to learn about the method in killing mosquitoes. With the help of the public representatives, we can better working together to spread out our ideas. Second, we need to educate people with more knowledge about simian malaria. For example, wearing long sleeves when staying outdoor and having bed nets for sleeping. On the other hand, people should try to stay away from the white light, especially monkeys. Also, covering up all the water containers will be important and helpful in avoiding infections. Last but not least, we will encourage the local communities to come over and learn about the symptoms of simian malaria from our physicians. With learning about the basic diagnosis, we'll let people have the early chances to isolate infected people and send them to the hospital, instead of staying with them for a longer time period with no idea if they are sick or not.
The top-down and bottom-up approaches previously mentioned are great ways to help solve the simian malaria issue Malaysia is facing, but there are always roadblocks that our One Health approach can face. One of those roadblocks is the language barrier. A language barrier can pose a serious roadblock when it comes to educating the population about the disease and how to decrease the risk of infection. In order to help overcome this roadblock, our One Health approach will incorporate translators to help us connect and communicate valuable information to the Malaysian population. Another roadblock our team can face is deforestation. In Malaysia, there is a strong case of deforestation due to the logging market. The people of Malaysia depend on this market for income. Deforestation is a big roadblock towards our One Health approach because it will cause simians to come in closer contact with the human population, thus risking their chances of infection. To help with this roadblock, our One Health approach will support governmental organizations like the Malaysian Timber Council, which creates tree farms that are specifically used for the logging market so deforestation won't occur.
Communication and outreach can be approached with three groups in mind: the general public, the government, and the scientific community, which includes healthcare and public health officials. All groups should stay informed on any updates and discoveries regarding the disease, the most important part of the process being prevention through communication with communities. Particular information to be conveyed to the public includes prevention, symptoms, why they should be concerned, and transmission. Government officials can work towards funding these programs and requesting funding from NGOs. Public health workers and healthcare providers should work in conjunction with the government and community leaders to set up short classes and seminars to spread awareness. A team of scientists in Malaysia should work on research of the disease. Any research would require funding and support from the government. Specific research to be conducted includes tracking the macaques communities in Malaysia and research into the prevalence of simian malaria specifically. Through communication with the government, scientists can work towards changes in policy to reduce areas for simian and human contact, such as limiting logging areas and times. Public health officials should also be made aware of the presence and prevalence of simian malaria as well as risk factors. Trainings for identification and treatment should be done for healthcare officials by qualified specialists. The government can also be involved with ensuring hospitals have the proper resources to diagnose simian malaria.